Different causes of labial hypertrophy or elongated labia minora can include, number one, being born with that particular anatomy. Number two, hormonal changes as the female goes through puberty. Number three, going through pregnancy and childbirth. We all know that that really changes our bodies. And yes, it can sometimes cause those labia to enlarge or thicken or elongate. And frankly, there's just time and gravity. Just like time and gravity affect any other part of our body, it can also affect the labia and the vulva. Oftentimes with excess labial tissue comes excess tissue around the clitoris or the clitoral hood. So if the labia is elongated, then that will travel up to the clitoral area. Most of the time, I would say 90% of the time when I do a surgical labiaplasty, I'm also performing a clitoral hood reduction. Otherwise, things don't look balanced or harmonious. If you just take care of the labia and don't touch the clitoral hood, then the patient will complain that the vulva looks top heavy. There's just too much tissue at the top, so now things are not balanced that way. Or I've heard it described as a bird beak appearance. So 90% of the time, a labiaplasty will be accompanied by a clitoral hood reduction. There are two main ways of having a labiaplasty, namely surgical labiaplasty or non-surgical labiaplasty if your physician offers it. So surgical labiaplasty is for those women who have elongated inner labia that bothers them either aesthetically or functionally. And that's where we actually cut the excess labia minora and tailor a really nice looking labia for the patient. It is surgical, so there is a bit of downtime. It's about a 6-week recovery period. But to be honest, the pain is not bad at all. Patients really tolerate it well. The most important things to have at home are ice, lots and lots of ice, especially that first week, some Tylenol and some ibuprofen. Most patients just need a couple of days of medications. And then they're good to go. But it is 6 weeks of recovery, meaning no sexual activity and not getting into water during that time. But you can go back to work after the first week. Scarless labiaplasty does not involve any incisions. The way this is done is by applying radiofrequency heat to the tissue under the skin as well as on top of the skin to firm and tighten up the labia. You would get about a 20 to 30% reduction in the size of the labia. It is not as dramatic as a surgical labiaplasty where we can remove as much as we want. But if it's just a little bit of a change, or frankly, if it's like part of a mommy makeover, you're doing okay, but you just want things to look a little bit better, a scarless labiaplasty is a great way to go. This also requires little downtime, much less than a surgical labiaplasty. Maybe just take 1 or 2 days maximum off of work. Do expect a little bit of swelling for some time, but really the downtime is minimal. I would say no sexual activity for about a week, and the pain, again, is not bad. Just have some Tylenol and ibuprofen available.